Good morning, students. We are going to study urolithiasis today. Urolithiasis, we learn about what is urolithiasis, what are the symptoms, what are the treatment, and we'll see some videos related to urolithiasis. Okay, so let's start. This is the overview. You can see this is the structure of the kidney showing stone at the different part of the the urinary tract. So there is a collegial stone in the kidney. There is a renal pelvic stone in the pelvic region, and we can see there is a upper urethral stone. Uh, Stone we can see in the ureter region. So there are different locations showing stone, right? Now overview about the urolithiasis. Urolithiasis is also called urinary calculosis or nephrolithiasis. So this urolithiasis is known by two different nomenclature, two different medical term. The first term we have written here, urinary calculosis. The second one is a nephrolithiasis. Both of them defines that this is a kidney stone. Okay, urolithiasis, urinary calculosis, nephrolithiasis. It's a the meaning is it's a stone formation in the anywhere in the urinary tract, right? The process of forming stones anywhere in the urinary tract, basically kidney, ureter, bladder, urethra. So anywhere in the urinary tract, if there is a stone formation, this leads to the complications, and we call them as a medical term urinary calculosis or nephrolithiasis, right? Kidney stones are hard deposits of minerals and acid salts that stick together in concentrated urine. So, what is kidney stone? What is urinary calculosis, or what is urinary lithosis? So, it is the first of all we need to define it, that it is a process of forming a stone anywhere in the urinary tract. Urinary tract start from the urethra to urinary bladder, then ureter, and then further pelvic, and then kidney, pelvic, renal pelvic, and then kidney. So these are the urinary tract, okay, and anywhere you can see the stone formation. Whereas kidney stones, if you talk about what is kidney, the nature of the kidney stones. So it's a they are hard deposits of minerals. Okay, the stone is what? They are the deposits of the minerals in the hard form. Okay, and in addition to the minerals, there are also some acid salts are there which stick together. Okay, because of the concentrated urine. When the urine becomes concentrated, highly concentrated, so the minerals and acid salts present in the concentrated urine, they stick together and they deposit anywhere in the urinary tract. And what we call, if it is deposited in the kidney, then we call it call the the term as a kidney stone. Okay, if it is deposited in the ureter region, so like upper ureter region, it can be upper ureteral stone. If the deposits are in renal pelvic region, then we call them as a renal pelvic stone, right? So here the kidney stones can be painful when passing through the urinary tract. So this is highly, this is the patient usually feels the the painful sensation during the passing of the urine, right? But usually don't cause any permanent damage when the urine the stone passes, or when there is a painful sensation because of the stone. There is may not be the permanent damage actually, but this is the what the patient experiences the painful sensation during the urination process, or when the stone passes through the urinary tract. Okay, right? And the symptoms people may experience. Okay, what are the symptoms that people may experience? The first is the pain. Okay, the sensation of pain is basically in the back area or in the side part of the body. Okay, so this is the symptom, the first symptoms. And then the pain types can be usually severe pain, or it can be like sudden pain in the abdomen region, right? And pain occurs during urination process. So whenever the patient do urination process, so at the time of urination, the pain usually, the, is felt. And there can be the gastrointestinal symptoms like nausea or sometimes vomiting also, because of the this stone pain sensation process. In the urinary process, the blood can be appear in the urine, or there can be the frequent urination process, right? The patient usually do many times urination process, or in the urine we can see the blood also sometimes. And the most common symptoms is a sweating, right? The patient, all type of patient who usually have a stone in the urine tract, so usually they usually have a sweating like a, sensation, or sweating like a symptoms. Now, what is the treatment for kidney stone? Let's know the treatment, that how we can treat the kidney stone process. What are the approaches to manage or to cure the urolithiasis? Okay, the first is the medication, where we can give pain relievers, like pain. The medication which relieve the pain can be given to improve the pain like, the sensation. And supportive care can be given, which means where we can increase the fluid intake, maybe orally and maybe through the intravenous fluid can be given. And drinking lots of water can help to pass the stone. Okay, this is the only, supportive care, that the patient should be given lots of fluid, maybe orally, maybe through the intravenous. And it will help the patient, when drinking lots of water happens, then it will help to pass the stone from the urinary tract towards the bladder, and then through the urethra to the outside. What are the medical procedures we can do it? So medical procedures are basically required to remove or to break up the larger stones. Basically the medical procedures can be the is minor surgery, or some, other approach can be done, which can help to remove the larger stones. Or it can be, the attempt can be done to break up the larger stones into smaller stones, which during the urination process they can slowly and slowly come out of the body. Okay, so here we have studied little overview, some symptoms, definition, and the treatment attempt that can be done to manage the urolithiasis. And here, now we'll see some animation here, that how this urolithiasis takes place. So I have, this is the animation you can see. Okay, and let's see the animation now. Let me, okay, present Google Chrome, then wait. Okay, now I have opened a YouTube, where you can see one video related to urolethiasis. Just listen carefully.
Before we talk about how kidney stones are formed, take a moment to become familiar with the urinary tract. The urinary tract includes the kidneys, ureters, bladder, and urethra. Now let's enlarge the kidney to get a closer view. Here's a cross-section of the kidney. Urine flows from the outer cortex to the inner medulla. The renal pelvis is the funnel through which urine exits the kidney and enters the ureter. As urine passes through the kidneys, it can become very concentrated. When the urine becomes too concentrated, calcium, uric acid salts, and other chemicals dissolved in the urine can crystallize, forming a kidney stone or renal calculus. Usually, the calculus is the size of a small pebble. But ureters are very sensitive to being stretched, and when stones form and distend it, the stretching can be very painful. Often, people may not know they have kidney stones until they feel the painful symptoms resulting from a stone being stuck anywhere along the urinary tract. Fortunately, small stones typically pass out of the kidneys and through the ureters on their own, without causing any problems. However, stones can become more problematic when they block the flow of urine. Doctors call this one a staghorn kidney stone, and it is obstructing the entire kidney. Fortunately, these stones are the exception rather than the rule.
A kidney stone can be as small as the head of a pin, almost invisible to the naked eye.
So this is the second video we are going to play, and just listen to the audio clips of the video and watch the video very carefully.
A kidney stone can be as small as the head of a pin, almost invisible to the naked eye. But as every stone former knows, the pain resulting from this tiny crystal structure can be enormous. Inside kidney stone disease. Kidney stones, or renal calculi, are aggregates of crystals enclosed in a matrix that develop within the kidneys. They're classified according to the specific types of crystals they contain and fall into 5 major categories: calcium oxalate, calcium phosphate, struvite, uric acid, and cysteine. The most common is calcium oxalate. How is a stone formed? The first step is nucleation. Ions such as calcium and oxalate that have been filtered into the urine by the kidney spontaneously join together to form a solid crystal nidus. This is called nucleation. There are 2 kinds of nucleation. In homogeneous nucleation, crystals form around a nucleus with the same composition. Crystals of a different composition can also form around the nucleus. Organic materials, such as cell debris, may be deposited between the crystals as a matrix. This is heterogeneous nucleation. The tiny crystal formations travel down the nephron and are usually deposited at the renal papilla, where they undergo the next major phase, growth. Crystals that have already formed then begin to stick together, forming large aggregates. As we can see, crystals can aggregate very quickly. New stones are retained in the kidney, where they can continue to grow for an unspecified length of time until, for reasons that are not well understood, they are displaced and travel through the kidney into the ureter. If a stone continues to grow until it reaches a critical size, which can be as small as 4 to 5 millimeters in diameter, it may be too large to pass easily through the ureter. The edges of the stone may become wedged inside the ureter at the ureteropelvic junction, where the ureter crosses over the iliac artery, or at the ureterovesical junction. The result? Pain and obstruction, until the stone slowly passes into the bladder and eventually passes out of the body in the urine stream. In the U.S., it is estimated that 13% of men and 7% of women will develop a kidney stone during their lifetime. Fortunately, in about 78% of these patients, stones will be expelled spontaneously. But stones that become lodged in the ureter may require lithotripsy or percutaneous or endoscopic removal. It's important to note that nearly half of all first-time stone formers will have another stone episode within the next 4 years. Recurrent stone formers are at even greater risk and may form a new stone every 2 or 3 years. But what actually causes crystals to form? Why do some crystals develop into kidney stones and others do not? One critical factor is supersaturation of the urine with stone-forming salts. Supersaturation is the driving force for crystallization. In undersaturated urine, crystals cannot form. The other important factor is a deficiency in substances called inhibitors. Inhibitors retard the nucleation, growth, and aggregation process by binding ions needed for crystal formation and growth. One of the most important inhibitors is citrate. Urine saturation and inhibitor levels explain why, in normal patients, large crystals are not formed. Their urine is not as saturated, and they have sufficient quantities of inhibitors present. But the urine of patients with kidney stones is more saturated. It may also lack inhibitors that increase the propensity for crystallization of stone-forming salts. There are 2 reasons for this. First, stone formers are known to suffer from a variety of metabolic disturbances that increase the amount of stone-forming substances excreted in the urine and also decrease the excretion of inhibitors. Second, a number of common nutritional and environmental factors can cause abnormalities in the urine. These factors may also exaggerate underlying abnormalities due to metabolic disturbances. Environmental stresses, for example, play a significant role in stone disease, especially factors that trigger excess water conservation in the kidney, such as inadequate fluid intake. Dehydration is a major cause of kidney stones, which is why people living in areas with high temperatures and humidity have a higher incidence of stone formation. A diet high in sodium is a double risk, because it increases calcium excretion and reduces urinary levels of stone-inhibiting citrate. Too much animal protein creates similar problems, encouraging stone growth by increasing urinary uric acid and reducing urinary citrate. Certain medications are also known to encourage stone formation or growth in susceptible patients, including common supplements such as vitamin C. There is no cure for kidney stones, but once an acute episode has been resolved, the key to therapy is simple: preventing recurrence. And fortunately, the most common stones, calcium oxalate and calcium phosphate, can be effectively managed with a combination of diet and lifestyle changes and medication. Compliance with proven management guidelines, such as increasing fluid intake and avoiding stone-promoting foods, can significantly reduce stone recurrence. Medical therapies, such as thiazide diuretics and potassium citrate, are also highly effective in appropriate patients and can reduce the need for expensive assisted stone removal procedures, such as shockwave lithotripsy, SWL. The economic burden.
So students, I have shown you 2 videos, and we have seen here that how the stone formation takes place, what are the risk factors, and how can we do the treatment procedure. Okay, in the slides during the presentation we have studied some symptoms. So based on the symptoms, we can do the diagnosis. We can do some uh, diagnosis through the body examination. We can do the tests. We can examine deposits of calcium oxalate, calcium phosphate in the urine. Okay, and we have seen that the supersaturation of the urine usually is one of the leading factor that helps in the formation of the stone in the urine tract. Now we have today we are going to end the lecture here only. Now we can discuss if you have any doubt.